Hello to all my friends and to my colleagues and my fans and my students everywhere. Today I will speak about an important issue, which is the thyroid breast link. Thyroid breast link. What is the link between the thyroid and the breast? Is there any link between the thyroid and the breast in clinical practice or not? The answer is yes. There is a definite relationship between thyroid and breast in clinical practice. And there is a correlation between thyroid disease and breast disease. But this relationship between thyroid and breast disease is not clear. Is it an association or what we call a cause-effect relationship? There is definite association between the thyroid and the breast. That is, any lady with thyroid disease might develop breast disease, whether after a short time or long time from the onset of the thyroid disease. And any lady with breast disease might develop a thyroid disease. So there is a bidirectional link between the two. And any lady with either breast cancer or thyroid cancer has an increased chance of developing secondary malignancy in the future after a short or long time. That is, a lady with breast cancer might later develop thyroid cancer, and a lady with thyroid cancer might later develop breast cancer. So this is the relation between them at the cancer level or at the tumor level. As a neoplastic association between the thyroid tumor and breast tumor. But let me first start by demonstrating or reminding colleagues and students about the relation between them at the physiological and the pathological level. Thyroid hormones is essential for the normal development, for the normal growth and development of the breast, starting from puberty. That is a part of the normal pubertal physiology in ladies, and also not only in females, and also in males. The thyroid hormones, but especially important in females, that the thyroid hormones is important for the normal growth and development of the breast in young women or in young females. At puberty, to be clear, at puberty, there is a link and there is an effect of thyroid hormones on breast development. And later on, they are also important for the production of milk in the lactating breasts. When the lady gets pregnant and then lactate her baby postpartum. So the thyroid hormones are important in both the development of the breast, number one, to start with, and number two, for the production of milk and the lactation process later on during pregnancy and after pregnancy for those who are nursing their babies. So thyroid hormones are important for breast development and for breast function, because we all know that the most important function of the breast is lactation, that is the production of milk. So there is also a relationship between thyroid hormones and oxytocin and the other lactotrophic factors. The relation between thyroid hormones and the lactation process and the hormones responsible for the lactation process, namely the oxytocin and the other lactotrophic factors, which are physiologically important in the production of milk and the expression of milk by the mammary gland. So this is the basic physiology of the relation between the, so definitely there is an association between thyroid and breast in health. And so, consequently, in disease, it's expected that there is a relation between the two. And this is expressed by the studies showing the relation between hyperthyroidism and autoimmune thyroid disease and thyroid cancer on one hand, and the increased risk of breast cancer on the other hand. So patients with hyperthyroidism and autoimmune thyroid disease are having increased risk of development of breast cancer. And patients with thyroid cancer have increased risk also of breast cancer, and vice versa. Or the other way around, that the patients with primary breast cancer, they have increased risk of development of thyroid cancer. So that any lady with thyroid cancer, we should follow her thyroid status, and we should measure thyroid hormones, and we should assess the thyroid clinically, and we should do ultrasound for the thyroid. And also, ladies with thyroid cancer have to be assessed for any breast pathology and check the breasts clinically by physical examination, and also by doing ultrasound of the breast, and by doing also mammography if needed. So, to detect any possible breast pathology. So this is another important fact, that patients with an overactive thyroid disease or an autoimmune thyroid disease, and the most common autoimmune thyroid disease, of course, as we all know, the chronic autoimmune thyroiditis, which is Hashimoto's thyroiditis or Hashimoto's disease, which is characterized by an autoimmune pathology and production of anti-thyroid receptor and antithyroglobulin antibodies, and increased risk of thyroid cancer in those patients with Hashimoto. And also they might get at the beginning thyrotoxicosis, Hashimoto's disease, what we call hashitoxicosis, and in the later stages of Hashimoto's disease, we get hypothyroidism. So Hashimoto, from the functional point of view, which is chronic autoimmune thyroiditis, passes through many phases as regards the thyroid function. First, it is normal thyroid, euthyroid, and then passes into stage of hashitoxicosis, and then after that, in the later stages of the disease, the thyroid gets burned out and it becomes hypoactive, and the patient gets hypothyroidism. So this is in Hashimoto. Studies have shown that patients with Hashimoto's thyroiditis, for example, which is the most common autoimmune thyroid disease. Of course, we have also Graves' disease, same, which is an autoimmune thyroid disease with anti-TSH receptor antibodies and hyperactive thyroid. This is another category of autoimmune thyroid disease, which manifests clinically with thyrotoxicosis, that is hyperactive thyroid. Both Graves' and Hashimoto's thyroiditis and Graves' disease, which are two thyroid pathological entities, are associated with increased risk of thyroid cancer, and they may be also associated with breast cancer. In some studies have shown that. In general, studies have shown that many studies have shown that patients with hyperthyroidism, that is hyperactive thyroid, they are at increased risk of thyroid cancer. So patients with hyperthyroidism, regardless of the underlying cause, whether it is Graves', whether it is toxic nodular, whether it toxic nodular goiter, whether it is the second common cause of hyperthyroidism, or toxic solitary nodule of the thyroid gland, which is another cause of hyperthyroidism. The commonest three causes: Graves', toxic multinodular or toxic nodular, and solitary toxic nodule of the thyroid. There is an increased risk of breast cancer. So hyperthyroidism is associated with increased risk of breast cancer. And on the other hand, patients with hypothyroidism, they have lower incidence or lower risk of breast cancer in some studies. Although some other studies have showed the opposite. That is, patients with hypothyroidism, they might get increased chance or increased risk of development of breast cancer. But so the two possibilities are there. But the studies showing the association between hypothyroidism and the lower risk of breast cancer is more. But there is also other controversial or contradictory studies in this report or in this issue as regards the relation between the hypothyroidism and breast cancer. But definitely the hyperthyroidism is associated with increased risk of breast cancer, while hypothyroidism is associated with lower risk of breast cancer. So there is definitely an association between the functional status of the thyroid gland and the breast status in health and disease. That is, patients with hyperthyroidism, that is hyperactive thyroid, might get breast disease, namely breast cancer. Also, they might get fibrocystic disease of the breast. They might get benign adenomas or papillomas in the breast also. Some other studies show that hyperthyroidism should any breast pathology, whether breast cancer or benign tumors of the breast or even fibrocystic disease of the breast, which is a benign breast disease, as we all know. So there is a definite association between the thyroid and the breast. But let me now talk about a very important link after talking about the relation between thyroid functional status and breast disease. Now I will talk about an important clinical syndrome which associates the breast and the thyroid together, which is called the Cowden syndrome. دي نقطة مهمة جدا لطلبة اللي بيدرسوا ماجستير ودكتوراه وزمالة وغيره، ان هو pay attention للسندروم دي، لأن ممكن يتسأل عنها في الكلينيكال اكزامينيشن أو في الأورال اكزام، because it represents what we call the hamartoma tumor syndrome or hamartoma cancer syndrome. The Cowden syndrome, it is also called the P10 hamartoma, multiple hamartoma or hamartoma cancer syndrome, because it is characterized by the multiple overgrowths, which are basically benign. That's why we call them hamartoma, because hamartoma or the hamartomatous tumor, it is a benign tumor to start with, but might later change into or transform into malignancy, or change into or goes into a cancerous process. But to start with, it is multiple hamartoma syndrome. Cowden syndrome, it is a hereditary condition. It's a rare hereditary condition to start with, which is transmitted as an autosomal dominant disease. And it's inherited autosomal disease, as I mentioned, autosomal dominant disease, which is characterized by the formation of multiple overgrowths in different tissues of the body, but mainly in the breast and in the thyroid. So the patient has thyroid hamartomas and breast hamartomas at the same time. But there is also increased incidence of hamartomas or benign overgrowth in other organs, in the kidney, which might transform also at one stage into renal cell carcinoma. They might get also gastrointestinal polyps and gastrointestinal hamartomas, which might change into colon cancer. They might get also hamartomas in the uterus, and which might change into endometrial cancer. So there is increased risk also of uterine polyps and uterine hamartomas in patients with Cowden syndrome. There is also increased incidence of tumors and other skin changes in the skin. There is hyperkeratosis, there is papillomas, there is lipomas. There is changes in the mucous membranes of the mouth. There is high arched palate. There is xerostomia. There is fissure tongue. There is mucosal lesions in the mouth. So there is definitely benign lesions or benign growths in the different organs of the body, but mainly it is present in the breast and in the thyroid. So, and the patients with thyroid hamartomas and the breast hamartomas, they are at increased propensity to develop thyroid cancer or breast cancer. If these cases, we should follow them for the possible future development of cancer in the thyroid. And if they start with thyroid cancer, they might later develop also breast cancer. Or if they started with breast cancer, they might later develop thyroid cancer. So they are at increased risk, although they start as being benign overgrowths, as I mentioned, hamartomas, they might change into thyroid cancer or breast cancer or the two together. So these cases which develop papillary or follicular thyroid carcinoma, they are at increased risk to develop breast cancer later, or adenocarcinoma of the breast. So we have to follow them for any breast pathology, and we have to check the breast. And also patients with which started with a breast cancer or breast carcinoma, whatever the type of breast cancer is, we should check also the thyroid gland for any swelling, for any nodule, and we should do ultrasound of the thyroid. So patients who started with either thyroid disease or breast disease, we should check them properly clinically by doing thorough examination of the thyroid. So any patient with thyroid disease, examine the breast of this lady, please. Don't forget to examine the breast. And any lady with breast disease or breast lump or breast tumor or breast mass or any breast pathology, check the thyroid also clinically. So we have to examine the thyroid thoroughly. We have to examine the breasts thoroughly in these ladies because of the thyroid-breast link. And we have also in the investigations, we have to do the thyroid function tests to check the functional status of the thyroid. Is it hyperactive or hypoactive thyroid? That is there any hyperthyroidism or hypothyroidism or not? This is very important, very mandatory to do thyroid hormones in any patient with breast disease. And also to do thyroid ultrasound. And if there is any suspicion about any nodule, whether solitary nodule or multinodule, do fine needle aspiration cytology, biopsy and cytology. And if later on it's mandatory, we can even do excision biopsy. That is, we excise a suspicious mass or tumor in the thyroid for possible malignancy, especially if the patient had a history of breast tumor or breast cancer. So this is Cowden syndrome. So Cowden syndrome, it is multiple hamartoma syndrome, which associates breast tumors with thyroid tumors. And there is increased risk of breast cancer and thyroid cancer in these patients. And so in a patient with Cowden syndrome, we have to follow up those patients. As I mentioned, it is a hereditary condition. We have to check the family members. It is a form of a tumor family syndrome, but here the tumors are in the thyroid and in the breast. Together, plus or minus the other possible pathologies or other tumors in other organs, as I mentioned, in the gastrointestinal tract. We have to check the GIT sometimes, or check the kidney. We have to do abdominal ultrasound. We have to do, there is also might be affection of the spleen and liver by having a tumor-like masses in the spleen and liver and pancreas. So the tumors, the pancreas and spleen and liver should be checked by abdominal ultrasound or even sometimes by CT abdomen, if there is a possible suspicious pathology detected by abdominal ultrasound. Check the pancreas, check the liver, check the spleen, check the kidneys in a patient with Cowden syndrome. And if there is gut symptoms, check the gastrointestinal tract. If necessary, we might also do endoscopy, especially lower gastrointestinal endoscopy, to check for any gastrointestinal polyps or tumors or hamartomas as a part of Cowden syndrome. So Cowden syndrome, although it is mainly an association between breast masses and thyroid masses, or breast tumors and thyroid tumors, there is also a possible association of other tumors in other gastrointestinal, in other systems or organs, as I mentioned, in the GIT, kidney, or other visceral organs. So this Cowden syndrome. So please don't forget Cowden syndrome as a link between thyroid and breast tumors, benign tumors at the beginning, or later on cancer, breast cancer and thyroid cancer. And the association between breast cancer and thyroid cancer might be classically explained by or exemplified by Cowden syndrome, the multiple hamartoma syndrome. Don't forget. Of course, this is in addition to the possible that thyroid cancer might give metastasis to the breast, although it metastasizes to the local lymph nodes, especially the papillary mainly metastasizes to the lymph nodes, the follicular mainly metastasizes to the bloodstream to other organs, to the liver, to the lungs, to the brain, but might also metastasize to the breast. And breast cancer may give metastasis through the bloodstream to the thyroid gland also. So the possible association through primary, secondary effects, or primary tumor, secondary tumor effect. So check the thyroid in any patient breast disease, and check the breast in any patient with thyroid disease. Professor Dr. Tarek Ali.